Hit by car injuries, unfortunately, is something we see quite a bit through the emergency. And then as Good Samaritans, you may see these on the road as well. Approach these animals, again, very slowly and cautiously. Most of the time, they're not your own pets, but if they happen to be, still, they can bite, they can scratch, they can turn aggressive because they're scared. They're oftentimes not acting normally in these situations. Apply a muzzle, and then also try to transport them. Now, when we apply a muzzle, a lot of people aren't going to have a nylon muzzle. They're not going to have an extra small, small, medium, and large, extra large muzzle sitting in your car. So in your first aid kit, you've got your gauze. And if you don't have your gauze, you can use a necktie, you can use any type of, you can use rope, you can use anything. Gauze just happens to be fairly soft and works nice to do a muzzle. I'll show you on Jerry how we typically will make a cloth muzzle. The basics are you want to tie a overhand throw over the mouth and then tie it behind the ears or behind the head. So you have your gauze, and all I'm going to do is just do one little throw like that, a little overhand throw, so you have a loop, okay? And then place it over the dog's mouth. And you want it snug. I mean, these dogs are amazing. If you don't tie it, fairly snug, they can get out, they'll paw at it or whatever. So you can tie it snug. And then you want to just take the gauze and go around the animal's head, behind the ears and underneath the ears, and then tie it behind the neck, okay? Once you do that, you're going to have an effective muzzle. Jerry's not very cooperative, unfortunately. His mouth doesn't go closed all the way. But you get the idea of what we want to do is just do an overhand throw, pull the muzzle or pull the gauze then behind the mouth. And actually what I've done here is made a mistake, so it's good to show you guys. When we do this overhand knot and we do the knot on top of the head, if you can see how close the gauze is coming to the eyes, that really, they don't like that at all. It can irritate the eyes, it can cause scratches. So actually do the knot portion on the bottom of the mouth and then pull that behind the eyes or pull it behind the ears, and that'll help do a gauze muzzle. Very effective, very easy to do with these patients. If the pet's having respiratory difficulty, you don't want to do a muzzle. It's probably best to either, you can use your blanket and cover the head so it kind of distracts them so you don't get bit. But be very careful if you're muzzling a pet that has respiratory difficulty or respiratory distress. It's best, you could, if you still had to do that, you could do the muzzle. And then once you get the pet mobilized into a vehicle or something, you could take the muzzle off. That way they could breathe easier whenever after you've moved them a short distance. Different things you can use as a stretcher, especially if you're at home. Things that work really well. Large cardboard box, flatten it out, and that's fairly rigid. You can help use that. Blankets are just great. They're not flat. They're not a hard, like a backboard or anything like that. But they work great for transporting these patients most of the time.